All right, let's review some practice questions related to the content of medications within the renal GU system. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can come to the correct answer independently, and then you can resume the video so that we can review the rationale together. All right, matrix multiple choice. So this specific matrix multiple choice is dealing with a patient who is prescribed Bactrim, and the nurse is providing medication education on that Bactrim. So with all of our matrix multiple choice, I want you to look at the statement and determine, okay, is that statement true or false? If it's true, it demonstrates an understanding of the teaching. And then if that statement is false or inaccurate, it demonstrates a lack of understanding of the teaching. All right, so there's two true statements here that demonstrate an understanding of the teaching related to Bactrim. So those are, each dose of the medication should be taken with a full glass of water, and then my urine turning dark brown can be expected and does not need to be reported. Those are both true. They demonstrate an understanding of medication education related to Bactrim. Also, the patient should be educated on the importance of maintaining a high fluid intake to avoid the development of crystalluria in the urine. The patient should not be instructed to taper or discontinue the dose. You always want to complete your entire course of antibiotics. That goes for antibiotics that for any sort of infection. The patient needs to be educated to use sunscreen because the skin can become sensitive to the sun when taking Bactrim. And then also, some forms of Bactrim can cause the urine to turn a dark brown or red, and this does not indicate the need to notify the healthcare provider. All right, this is a drag and drop style question testing your knowledge of physiological integrity. The nurse is caring for a 64-year-old male patient who presented to the emergency department with complaints of an inability to void. Past medical history consists of anxiety, depression, seasonal allergic rhinitis, hyperlipidemia, hypertension, and BPH. The nurse notes the following when performing a chart review. So this 64-year-old patient is currently prescribed Prozac, atorvastatin, lisinopril, over-the-counter Benadryl as needed, and he also takes over-the-counter Afrin as needed. He has reports of recent nasal congestion and postnasal drainage with use of Benadryl and Afrin for about 2 days. His heart rate is 94, BP is 138/80, O2 is 99% on room air, and respiration rate is 18. So based upon this piece of the patient's medical record, the nurse determines that the patient is presenting with urinary retention, likely caused by the use of blank, blank, and blank. So looking at our answer options, we know that these are all classes of medications. So if the patient is presenting with urinary retention, which drug classes do you know can cause urinary retention? All right, so in a patient with BPH, episodes of urinary retention can be triggered by certain medications, including decongestants, anticholinergics, and antidepressants. So these medications lessen the voluntary ability to contract the bladder. So the patient should be questioned about the use of these medications if he presents with urinary retention. ACE inhibitors and statin medications do not affect the patient's ability to urinate. All right, this is a classic multiple choice style question testing your knowledge of physiological integrity. The nurse is working in an after-hours call center for a local primary care office. A 34-year-old female patient who started a prescription for Macrobid 2 days ago for the treatment of a UTI calls reporting new onset, difficulty breathing, cough, fever, and chills. The nurse would advise the patient which of the following. So just started Macrobid, and now the patient is having difficulty breathing, a cough, fever, and chills. Would the nurse instruct the patient to come into the walk-in clinic tomorrow for a flu screening, immediately stop the medication due to anaphylaxis, continue the medication as symptoms are expected side effects, immediately stop the medication due to a pulmonary or hypersensitivity reaction, or taper the dose over the next 2 to 3 days to resolve symptoms. All right, the nurse is going to advise the patient to immediately stop the medication due to a pulmonary or hypersensitivity reaction. So, macrobid can induce two kinds of pulmonary reactions, acute and subacute. So, those acute reactions, which are the most common, manifest with shortness of breath, chest pain, chills, fever, cough. These symptoms usually resolve 2 to 4 days after discontinuing the medication. Acute pulmonary responses are thought to be hypersensitivity reactions. Now, subacute reactions are rare and occur during prolonged treatment. So these symptoms would usually regress over weeks to months following a macrobid withdrawal. However, in some patients, pulmonary or permanent lung damage may occur. All right, this is a drop-down style question which will test your knowledge of physiological integrity. The nurse is caring for a 52-year-old male patient that is 6 days post-op from a renal transplant. The patient is newly prescribed cyclosporin, prednisone, and a short course of Bactrim. The nurse is preparing the patient for discharge and providing discharge education. The nurse advises the patient to avoid the consumption of blank due to its interference in blank. So the patient is prescribed cyclosporin, prednisone, and Bactrim. So based on that small piece of knowledge we have, the nurse should advise the patient to avoid consumption of what? And then once you have that answer, you can select your best answer option for the second option. So the nurse advises the patient to avoid the consumption of grapefruit juice due to its interference in the cytochrome P450 system. So a compound present in grapefruit juice inhibits the metabolism of cyclosporin through the cytochrome P450 system. As a result, the consumption of grapefruit juice can raise cyclosporin levels by 50 to 100%, therefore greatly increasing the patient's risk of toxicity. All right, classic multiple choice, testing your knowledge of physiological integrity, health promotion, and maintenance. So the nurse is caring for a patient recently prescribed ciprofloxacin for the treatment of a urinary infection. Which of the following is the most important to include when providing medication education? So a patient is on ciprofloxacin. Which of the following is the most important to include when providing medication education on Cipro? Immediately report the presence of any leg pain, avoid consumption of grapefruit juice, avoid consumption of green leafy vegetables, urine discoloration can be expected, or the medication is contraindicated in kidney or liver disease. So which of those is important when educating on the use of Cipro? And the correct answer is to immediately report the presence of any leg pain. So patients taking fluoroquinolones, including ciprofloxacin, are at an increased risk for tendinitis and tendon rupture. So it's very important to recognize tendinitis and tendon rupture as a risk and provide instruction on immediately notifying the healthcare provider if the patient is to experience any leg pain.